Hi everyone, today we're going to be talking about cerebral palsy. So cerebral palsy is a very debilitating disease that occurs when in infants in the developing brain. It can affect movement and it can affect balance and gait and cognitive abilities.
Okay, so in cerebral palsy, damage occurs to the infant's brain either right before or right after birth, and this can be due to physical trauma, hemorrhage, hypoxia, or other things. This damage causes necrosis of the brain tissue, which will then impair motor function, posture, muscle tone, and even cognitive function sometimes. Okay, so some risk factors for cerebral palsy include infection of the mother during pregnancy, such as from toxoplasmosis, chickenpox, herpes, and then other viruses. It could also be from an illness of the newborn, such as bacterial meningitis, viral encephalitis, or jaundice. And then some treatment options kind of depend on the severity, but they include physical therapy to help with walking and other movements, occupational therapy for activities of daily living, and then also speech therapy to help with speaking or swallowing and eating. And then there's also other adjunctive therapies such as pool therapy or equestrian, just to help with more motor movements. And then treatment kind of depends though on what exactly is affected, whether it's the upper extremities, the lower extremities, cognitive function, or all of those.
No two people with cerebral palsy will have the exact same symptoms. The disease has a wide range of severity and different effects that it can have on the body. There are 3 subgroups of cerebral palsy symptoms, and they basically just go with where in the brain is damaged. The first subgroup is spastic cerebral palsy. People with spastic cerebral palsy will have trouble with walking. Their gait may be wide, they may walk on their toes, their knees could point inwards or outwards. They also could favor one side very obviously. These people may also have trouble with swallowing, drooling, and talking. The second subgroup is dyskinetic disease, and it is manifested by stiff muscles and exaggerated reflexes or spasms. Tremors may be present, and there may be slow writhing movements like bringing up the hands. This is called by damage to the extrapyramidal tract. The third subgroup is ataxic cerebral palsy that is caused by damage to the cerebellum. Because the cerebellum is involved with balance, they'll have trouble with standing and walking, standing straight. They will also have large variations in muscle tone and may have areas that are very, very strong or very, very weak. Other symptoms associated with cerebral palsy include seizures and delayed speech development and delayed milestone achievement. These are associated with all 3 types, and they really just depend on the severity of the disease.
I'm here with Cate Hutchens, who is actually taking care of a boy with cerebral palsy, and his name is Jason, correct?
Mm-hmm.
Okay, Cate, can you tell us some daily activities you do with Jason?
Okay, so waking up in the morning, he has to be lifted in and out of his bed. He cannot walk or talk, which is not for all cerebral palsy patients, but specifically for Jason. He cannot walk or talk. So in the morning, I warm up all of his muscles, go like that, warm them up. They have to be prepared for movement, or it can be painful. It can just be kind of uncomfortable. You know, like if you work out really hard and your muscles are sore, he's like that all the time. So he has to be warmed up, he has to be prepped. And that's when we distribute medicine through his G-tube, which is in his stomach. It's right to the side of his belly button, and it goes straight into his stomach. And then we have breakfast, where it's all pureed foods all the time for breakfast, lunch, and dinner. He can swallow, but it's all done through like muscle memory, because every once in a while he'll kind of look at me with these eyes like in a panic, like, and then I go like that. And it encourages him to like just kind of let it slide down. So he pushes his tongue forward and just kind of his chin out, like, and it kind of slides down.
Okay.
Like that. And then daily activities. He has his iPad. He has control over his right arm and his pointer finger. It's usually bent. His fingers usually kind of remain in a fist. Yeah, kind of like that.
Okay.
And then he has control over this, so he'll push buttons, he'll move stuff on his iPad, things of that nature. But this is really his most control in his body.
And are there any like daily activities that he struggles with, or maybe you struggle with?
He has a hard time getting dressed in the morning because his muscles are so tight. So getting his arm through his clothing is sometimes a fight because it's like he's frozen. And I'll push and push and push, and he's just kind of there. And then I'll have to encourage him, and usually tapping and like going like this, and you can usually encourage their muscles to bend by finding those joints and then hitting them so they kind of retract. And even for his legs too, so it'll be straight, and then I can hit it, and he's like, right, it's kind of like an automatic response. So you can usually encourage muscle movement, but it is hard for him, and I know it's hard.
So what are some like safety precautions you have to take with Jason? Like does he have like a fall precaution? Do you always have to have a gait belt with you or something like that?
While he's in his wheelchair, he's obviously strapped with all of the straps in his wheelchair. He's very prone to seizures, and that has to do with he has cerebral palsy, global developmental delay, autism, and a list of all kinds of things. And things that he's allergic to. So for that, like, I know his specific dietary needs, so he doesn't have any kind of food that his mother, his father, or I do not give him.
Yeah.
It can lead to allergic reactions. And for his seizures, I always have his EpiPen. Moms carry a diaper bag with all of their baby stuff, and it's the same thing for Jason. Like, I always have food, EpiPen, medication, a list of his medical needs in case something happened to him or we were out.
Okay. Also, communication. You mentioned that he's not able to like speak normally. So how would you communicate with him normally? Would he like tap something, or would he just like make facial expressions?
Mostly facial expressions. A communication board was worked with him for years. He never caught on or didn't want to. And then sign language, he never understood, learned, or didn't want to do sign language. So none of those communications were like, he can't talk. His laugh is kind of a and I can tell, and he smiles. He's he's a very, very happy kid. So you can tell, I think everybody can tell when somebody's happy, and it's the same for Jason. Like, I think he feels love and he feels happiness and he expresses it. But there's no words, there's no really set communication.
So he's probably very dependent on people, so he probably can't like live on his own. But are cerebral palsy patients like not as severe? Can they live a normal life?
Absolutely. For a cerebral palsy patient, you may see that their gait is not typical, or their arm motions are not typical. Clumsiness can usually be associated with it. Like, they'll just kind of like they'll drop something and they'll knock something over. I think there's some patients with cerebral palsy, it's kind of like, oh man, I knocked my coffee over again. Like, come on. So typical things like that. But and it just depends on the severity. They live very normal lives. Maybe their gait is off or their motions are off. But yeah, and then it depends on, and treatments can help with either progression, whether it progresses or not. It's completely up to the person. And they're typically smaller.
Yes.
Smaller firms. So it's not that they're really, really tiny, but maybe somebody whose family is all 6 feet and above, and then they're 5'4", 5'5". It's kind of like untypical. It's probably due to the cerebral palsy. Like Jason is, he's barely 4 feet because his muscles and bones and everything just kind of stopped, and maybe their feet and stuff can maybe look swollen. Yes. Like the cankles and stuff like that. So that can be a typical symptom of that. You maybe look a little bit swollen from lack of use. Like Jason, since he's not walking all the time as much, as his legs and his feet kind of look a little swollen. And you know how babies, their feet are shaped because they haven't been walking a lot, so it's not like flattened out like our feet are. That's a very typical. They kind of look perpetually like they have baby feet.
Okay. And there's no treatment for this? Is it just like physical therapy?
No, I mean, it's not, it can't be cured. It's
Mhm.
just what their body is, how they were born, how their body is.
Mm-hmm.
There's treatments to help. Jason has a metal rod in his
Okay.
back, and that helps him. He no longer can sit up on his own, which is a little unfortunate, but it's better in the long run to have a metal rod. So there's.
Well, awesome. Thank you so much for your time. It was great talking about Jason with you.
Yeah.
And I hope he does so well in his life.
There you go.
Hey, guys.
Make sure you like,
Comment, subscribe.
And ding dong that notification bell for more videos.
bye.